We would like to know what you mean by cyberknife.
You have heard since so many years saying that cancer is curable if detected early.
Yeah.
And this is a very, I think, slogan that is over the years has been played often. But many times, even if the patient is detected early cancer, the surgery sometimes is not possible because it may be sort of around the blood vessel, or the patient may not be in the condition to undergo surgery. And many of the patients are now more than 70, 80 years old. In those patients, surgery is difficult. For our slogan, even though we used to say it is curable if detected early, and we were in a position of not offering a curative method.
Correct.
And in such situation now, wherever surgery is required, but surgery is not possible, or during the surgery they have left some disease somewhere else, then it is possible now to offer this alternative treatment in such patients. Even today, the standard of treatment in most of the patients who are detected early is surgery. But when it is sort of not possible due to various reasons, then this is the second option that can be offered to the patient. And in, for example, in lung cancer, it is expected to give as a good result as surgery. And now a trial has started in Stanford University in USA, where they are offering it as an option. Wherever the patients feel, no, we don't want surgery, they are offering this type of treatment. Therefore, anyway, it is now a option that the patient can look for when they are told that, okay, surgery is not the situation. The importance is that, like surgery, it sort of ablates the tumor. It cuts off the tumor inside. While the tumor remains inside, it cuts off the tumor. And because of that, you get a good local control. And because these are patients who are early, they are cured. For one group of patients are this. The second group of patients, say we give regular radiation, we give chemotherapy, but in the end of all this treatment, there will be 1 or 2 or 3 places, 4 places, disease may be remaining. They are under control, they have come to total control, but just because we are not able to control the last portion, they will have recurrence and comes back. In such situation also, if you can add cyberknife at that time, when we have controlled the disease all over the body and few places it is remaining, there is a hope for cure. And in fact, even in patients who have disease all over the body, and in some patients which grows slowly, it is found that almost 20-25% of the patient can be cured with the modern day chemotherapy, surgery and cyberknife combined together. Therefore, in early cases, cyberknife alone. In advanced cases, cyberknife with other modalities of the treatment has improved the cure. And because it treats only the tumor and surrounding tissues are not treated, therefore one need not fear much about the side effect. Any effective treatment, there will be some side effect. But as doctors, we are just trying to reduce to a insignificant level. To that level, this technology helps in treating the patient. For these are the two major. And in the third situation, say patient is suffering from severe pain, not able to sort of bear it despite the drugs control. In such situation also, even though our objective there is not to cure the patient, but to relieve the patient of discomfort. That is called improving the quality of life. That is the most important, because many patients look forward to this. They say, we don't want to suffer. It's all right. We know the sort of, but we don't. And at that time also, in such patients also, this can relieve the pain and other discomfort for the patient and improve their quality of life. These are the situations where it is useful. Not that it is useful in all situations, but specified situation, it can cure the patient. And in many patients, the other treatment, it can help to prolong the life. And in other occasions, we can improve the quality of life.
So you mean to say this is like adding life to the years?
Yes.
So apart from, as you rightly said, that if it is detected early or if the patient can be managed, it again, like what are the different types of cancer which comes under your purview of this cyberknife? One thing I would like to know. Second thing, how you go about this cyberknife treatment? Like how is the modality? Once you said, okay, like say for example, CA prostate, then how you go about it, like in your cyberknife management?
There are tumors which move within the body, and tumors that doesn't move that much within the body, and they are and in such patients like brain cancers or in the head and neck, they sort of don't move during the treatment, and such patient we sort of treat the patients within 5 sittings with CyberKnife.
Yeah.
The conventional treatment takes about 6 to 8 weeks of radiation treatment, but here within 5 sittings the patient will be back home. And we have a saying that we prefer to send the patient from the treatment couch to the office. To that extent, they go back to their normal life sort of immediately, especially with the early cancers where cure is possible. With this treatment, they can go back to their normal activity very well. And in some of the tumors where it moves with the respiration, like in the lung or in the abdomen, where they move because of the gas and other things that are happening, then we put some what is called gold markers. They are small seeds which are about 2.5 mm. We put inside the tumor or around the tumor so that we know where the tumor is. Robot will then know because of this gold seed, robot will know where the tumor is, because it is mathematically precise. It exactly knows where the tumor is. If the tumor moves, the robot also moves and treats the tumor precisely. And because we give that kind of only to the tumor treatment, it is possible to get a better tumor control and better cure rate also is a possibility. And in such situations, when we insert we wait for 5 days. For example, day 1, patient comes and we complete the imaging. Nowadays, we the PET scan, the MRI, there are lots of all these images or information is pulled together. They are fused one over the other, and we precisely decide where all the cancer is and where it is not, and where the normal structures are there. That takes about 2 days for us planning. For day 1 patient comes, we do the imaging, 2 days we take for the planning. 3rd day, if the fiducial is not required, we start the treatment, and 6th day patient is home. If the patient requires the fiducial, we put that, and we wait the 5 days for it to settle down, because it can move a little bit, and that can affect our treatment. Therefore, we allow it to settle down, and after the 5th day, we plan, we do the scan and do the planning, and another 5 days of treatment. By 12th day, 13th day or 15th day, patient is back home and back into the work.
Yes, sir. So this has given a lot of relief that way, means what otherwise the patient would have gone for 2 months for the radiation treatment. This can be, I mean, there is a time saving, at the same time you may say this is a lot of comfort, because the person can right from the hospital can go for his job. Means it also means that means there are no much side effects which should deprive his normal routine activity. Doctor, as you said about this gold, which is now once you insert that, it remains over there. What is this?
These are gold is supposed to be never allergic to the human body.
I see.
And both from outside or from inside also. And because of that, it remains forever. Once we insert, it remains forever. It doesn't cause any problem. Therefore, it is not because removing would be difficult.
I see.
Once we put a small thing in the body, to remove again, it is difficult. Therefore, it remains in the body and never causes a problem, because it has been now being used for the last 10 years in the international the other countries like USA and other we haven't had any problems with that.
Doctor, I would like to know, like, what type of cancers are ideal for this your CyberKnife management?
In the brain cancer, where surgery is not possible. Even brain, there are some non-cancer conditions also. They are called a bleeding spot could be there in the brain, deep within the brain, where surgery is not possible, because if you attempt to do surgery, there will be the disability, body can have disability, and in such situation this can be even both cancer and non-cancer, some benign condition. Brain tumor is one of the important for CyberKnife. In coming to the head and neck region, what we call, there are, after the regular treatment, if there is a disease remaining somewhere, then the CyberKnife is useful. When we come to the lung, and there is what is called early cancer lung, we call that stage 1, and in that stage 1, if it is detected and if it is surgery is not possible, this is a very good form of treatment in getting a very as much as the surgical what cure you get with surgery, you can get with this treatment. And when we are moving into the abdomen, liver, pancreas, these are the structures we never used to treat earlier. Actually, in my last 30 years of practice, about 10 years back, these patients never used to come to my department. But now, be it liver cancer, be it pancreas or cancer, and if you go down the prostate which is coming up, these are the structures where the cyber knife is becoming more and more useful. Therefore, literally all over the body, there are several structures, especially when it is early stage, it will be very useful to have this type of treatment.
In the breast cancer?
In the breast cancer, usually this is not offered,
Achha.
but many times what happens, breast patients will have disease in one disease in the lung, one disease in the liver somewhere, or in the bone.
Achha. So
After the regular treatment is over, if that disease is remaining, that can be a focus for coming back, and that can be treated at that time, and we can have there is a what is also called, we make the patient live as long as disease, without disease as long as possible. Therefore, that is called, in our technical term we call that as disease-free survival. Without surviving without disease as long as possible. For that objective is also achieved with this type of approach.
Doctor, thank you very much. You have really given us a lot of insight into this newer technique of management of cancer patient. Before we wind up, I would just like to know from you what you would like to tell our viewers, means what you would like as advice or take home message, so that they can also be little vigilant about their own self. At the same time, they should be vigilant and know about newer medicines, newer modalities of management, and live a better life or quality life.
In that direction, I can tell about two aspects. One is now as the days are going by, the treatment is becoming more and more personalized. Now when a patient comes, it is not just the diagnosis. We decide, we sort of go into the depth and decide what is the nature of this cancer. Two patients can have the same type of cancer, but the outcome is different. That is because each cancer has its what is called genetic nature. Nowadays we classify genetically what is the type of cancer, and this type of treatment is called personalized medicine.
More of a tailor-made.
Tailor-made to an individual. Therefore, we analyze what is the receptor status, and based on the receptor status, we put a combinations of treatment, like a combo treatment, and then that deliver. This improves the chance of cure, and this improves the chance of having good quality of life without side effect. So this is the one. Our treatment is becoming much more, and nowadays we call cancer as a chronic disease. The more and more tablets are coming now. Therefore, like diabetes, like hypertension, I am sure that in another 5 to 10 years, it will be like you take a tablet every day and you keep the cancer under control, under check, if not cure, like you sort of handle a diabetes or hypertension. That is the one that is happening, and I can see the difference in my practice. About 20 years back, patient used to be, when they come to me, they would be sort of depressed and demoralized. But now I see a lot more change in the attitude of patients. Nowadays patients are so work oriented, so they want to get on with the life, they want to do lot of things in life, and this becomes as a shock, and they suddenly they have a priority. They set up the priority. I want to do these things, and they want to get back to the job very fast. Because of that, it is okay.
So we are giving a better quality life. Doctor, thank you very much for spending your precious time. Just since it is time up, I have to we have to wind up. But I'm sure that in coming sessions, we'll still have elaborate discussion and will be more patient friendly. Thank you very much. So nice of you.
Thank you.